Hi, everyone in the audience. Welcome. Just to let you know, we're just getting started and we are waiting for people to join. So we'll be starting off in just a few moments. So yeah, make yourselves comfortable and we'll get started in just a few minutes. Hi, everyone. For those of you who are just joining us, we will be getting started very shortly. We're just waiting for a couple more people to join in and we'll be getting going in a minute or so. Okay, hi and welcome everyone, and thank you so much for joining us at this next session of the Start Network Assembly. You have joined us for the announcing the results of the Working Differently challenge, and we've been really excited about this particular challenge this year and really excited to have this session to announce the winners. So thanks very much for joining us. I'm going to keep you all in a little bit of suspense about launching the winners, and I'm just going to run through just a couple of quick points about the challenge and why particularly we wanted to do this challenge this year, and then we'll get on and announce the winners fairly quickly and give them a chance to also speak to you today. So this is just a half-hour session. We'll get through this fairly quickly. But just a little word on why is Start Network particularly interested in innovation? What is it that we have sort of embraced here, and why do we think it's important? And just a couple of words on this really. One is that as an organization, as you know, we've really embraced the notion of systems change, and in particular moving to a humanitarian system which is really locally led. And we think really fundamentally that's a pretty major systems innovation. And to be successful in that, we're going to have to embrace a whole bunch of different innovation techniques and tools about working in complexity and using design thinking. And that's really probably the main reason why we've decided to embrace innovation of one of the strands of our ways of working. It's going to involve changing roles for all sorts of organizations. And going through that process of change is going to involve some really kind of complex thinking about what new roles need to look like. We've embraced things like human-centered design that gives us an opportunity to really put communities affected by crisis at the center of humanitarian response, to give them a position in designing and implementing programs that give them dignity, that give them control and give them leadership in humanitarian response, and to start building locally driven humanitarian solutions that are contextually appropriate and locally designed. And that's just some of the reasons why we've been embracing innovation as a technique. For this challenge was particularly focused on member agencies and also the partners of member agencies and hubs working together. This we felt was an opportunity to introduce some of these innovation techniques and tools, particularly to our member organizations. We hope it will give them some experience in working in innovation. It'll give them some experience of using some of these design tools, for example. We'd love for this challenge to surface some good ideas that are kind of bubbling away out there and maybe haven't yet made the mainstream. They need an approach which is a bit more risk tolerance to be able to support those ideas and take them from being young ideas to being more mature and developed ideas. We obviously want to be able to support the participants to develop those solutions further and give them an opportunity to develop those solutions. And we want to be able to showcase those ideas to the rest of the network to say, look, these are some of the things that are going on amongst your partner organizations. And these are some of the approaches maybe you could partner with in the future as these ideas get more developed. Excuse me. So this challenge was particularly looking for sort of ideas, things that were kind of working away but haven't yet made the mainstream. And we sort of identified a few areas that we thought would be really relevant. Obviously, COVID-19 this year, everyone has to adapt and change their way of working to work in the context of COVID-19. But other than that, we were really interested in locally led assistance. What does that look like, and what is the cutting edge for that? Programs that work on accountability to crisis affected communities, and more broadly in the area of social accountability. And these actually, some of these of course are new, particularly COVID-19, but some of these are things that came out of our assembly last year that some of our members identified in a session as being real priorities at the moment for us to work on. And the approach that we'll be really pushing through this challenge is one of testing, of prototyping, of iterating and learning. This is not about coming into a program with a preset idea. This is about using tools that enable us to learn and iterate as we go along. So we're trademarking the no log frames approach. For those of you who remember the Naomi Klein's No Logo book of about 20 years ago, probably this is the next level. There'll be t-shirts coming out afterwards. So what we were looking for really was a problem that was particularly relevant. So we actually did accept a few submissions that were not in those preset areas, so long as the applicants were able to demonstrate the relevance of that problem locally. We're looking for a team that's bringing diverse perspectives, but particularly willing to change and adapt their ideas. And we're looking for a solution area that is built on user feedback, right? So this is not all about the participants' ideas. It's really about who the users are and what their ideas are about what will work. The prize itself includes what will be a customized package for each of the winners. So we're going to be very much built around a mentorship and coaching approach. There will be access to a development budget. And there'll be other things like, for example, guidance on the use of digital technology. We'll be very much about networking and making connections to peers and potential partners. Thinking through business models, again, working on prototypes, testing those prototypes, and thinking through how to solve the problems that will inevitably come up along the way. So that's me going through very quickly, just a very quick overview of this process. We're very lucky on the program to have a partner working with us called Thoughtworks. Thoughtworks has been supporting some of Start Network's programs for a couple of years now. In fact, they worked with us very closely on the DEP Labs program, which some of you may be aware of, which was a community-led innovation program. I'm just actually going to invite Nag Kandukuru from Thoughtworks to say a few words for us. Just to introduce to us, Nag, maybe if you will, on particularly why this challenge is important for Thoughtworks and why you are what you are bringing to the program.
Sure, thanks, Neil. And for us, it's an absolute privilege to be working on the program and with you as well, Neil. Before we do for I say something about what I might be able to do and what we might be able to bring to the program, a little bit about Thoughtworks. We are innovation advisors to the challenge, as Neil mentioned, and we're a global consultancy specializing in technology and innovation. We've been around for around 27 years, and we've advised and worked with thousands of public sector, private sector, development, humanitarian actors, and so on. And some of the names familiar to this group would be UNICEF, MSF, etc. We're currently around 9,000 people in 15 different countries, and we're very, very close to $1 billion in annual revenue. And as Neil mentioned, we work very closely with the DEP program, and some of you will be familiar with it. DEP is Disasters and Emergencies Preparation Program, and we work with roughly 45 grassroots innovators in all kinds of domains: agriculture, finance, livelihoods, and so on, in Kenya, Bangladesh, Jordan, and the Philippines. A very rewarding program, not just because we were able to make a difference to the innovators in the communities, but also because we were able to bring very interesting methodologies to the fore. For instance, how do you rapidly prototype an idea so that you get feedback from users as quickly as you can? Because it is possible for you to spend months upon months, years upon years, perfecting your idea, and then when you go out into the field, it doesn't work. So one of the things that we've been advocating is get to the field as quickly as you can using rough and ready prototypes. So there is a number of techniques to it. There's an art to it. There's a science to it. That is something that Thoughtworks in general is an expert on, and that's something that we hope to bring to this program as well. Another thing is, how do you make changes in your plans based on the feedback that you're getting? As someone wise said, the planning process is important, but the plan itself isn't. And once you take your idea to the market, you prototype to the field, you will get a lot of feedback that you need to incorporate into the innovation. So once again, there is a science and an art to doing that. That is something that we want to be able to help with as well. And then based on all these things, how do you arrive at a reasonable funding plan for 18 months or 24 months, including goals, measurements, metrics, stuff like that? Just because there isn't log frames, and I'm supportive of the idea, that doesn't mean that there is no metrics or measurements of success. And each innovation calls for a different type of metric, different type of measurement. And that is something that we expect to help the innovators with as well. Overall, what we bring to the program is going to be very custom. It's not going to be, here is a method that's worked somewhere else, and here is something that everyone should be adopting. Very much based on what the innovator seeks to do, what the conditions on the field are, and most importantly, what feedback are users providing. So that's what we hope to be able to do. Also, Thoughtworks is in 15 countries, and therefore we have a good blend of the global south and the global north, we'd like to think. For instance, I'm myself based in Bangalore in India, and my experience is largely in tech, but also in other domains. So that's a little bit about us, and that's what we expect to bring to the program. Neil?
Great, thanks so much, Nag. And I should add, Thoughtworks are very kindly donating their time to this project, which we're very grateful for. And yeah, it's been a privilege to work with them on previous projects too. Another shout out quickly, I'm just keeping you all in suspense for a tiny bit longer. So there was a, a very esteemed judging panel that that went through the different entries, and we received a lot more entries than we were expecting. And it was a very competitive field, actually. And I want to just say a very big thank you to everyone that took the time to submit an entry. And it's like, hopefully in future, we'll be able to repeat this program and expand it and have the opportunity to provide support to a larger number of organizations, particularly if this proves to be effective. But yeah, a shout out to these people, really. Fatuma Bakari, Nag, who you've just met, Bhavya Srinivasan, Ian Gray, and Michelle Villarias. Some of them were alumni from the DEP Labs, and all of them have gone on to develop expertise and innovation and took the time to go through the submissions to this competition. So thanks very much, guys, for those of you that might be online. So I think I'm coming to the winners of the challenge next. So like I said, we had quite a few submissions. All of them were of high quality, and we were able to choose 3 winners, and I'm going to announce the winners in no particular order. We didn't rank the top 3. We just have 3 different submissions. We were looking for a bit of a portfolio of different types of project, different approaches, different teams, different countries, and we're really excited with the 3 winners that have been chosen. So coming on to the winners, the first that we're going to announce today is, I've already said that, is Cadena. So Cadena, we will introduce to you shortly, and they will be able to just say a few words on their project. It's a COVID-19 information project working with cutting-edge information technology, and we'll come to them in just a few moments and give them space to say a word. But I'll just run through the other winners first. The second winner is a group of Islamic Relief, Bright, and a Single Drop for Safe Water, working on a project of community designed humanitarian response, working closely with community groups and local government on a program which really takes a human-centered design approach to what they're doing in a very cutting-edge way. And the final project that has joined our 3 winners today is Tear Fund. And Tear Fund's project is looking at the use of alternative currencies in Ethiopia as a way for supporting local livelihoods, particularly in the COVID-19 environment, which is obviously economically very challenging. So those are our 3. Before I invite Abril from Cadena to say a few words, I just wanted to have also another shout out for 2 other projects. Health Nest Uganda and the Living Water Community in Trinidad and Tobago were both ranked equal 4th. And so you guys were really, really close, and we'd love to stay in touch. And I just want a big shout out to you guys for the very excellent submissions that you guys put in as well. So I'll just come back maybe to Abril Pays. And Abril, can I invite you just to maybe say a couple of words, share a little bit about your idea that you submitted and why it's important to you?
Sure, I'm gonna share my screen. Can you all see it now? Can you see my screen?
Yes, so great.
Oh, thank you. Okay, so our project is, it's called a goal, which is an Hebrew word. And we were trying to solve a really big challenge that all the humanitarian organizations were facing, COVID-19. So what was going on in our country by the beginning of the pandemic? There was a generalized misinformation in the society, and there was a lack of understanding what was different between COVID-19 and any other kind of flu. And people didn't know how it was prevented and which were the consequences of it. Also, there are a lot of people, a lot of poor people in our country. So there was a really big need for these people to still go out to the streets and still work. But then a lot of businesses needed to close because of the situation, and the unemployment rates started to grow. So two things happened because of this reason. First of all, there was also a generalized situation of food insecurity and a generalized situation of anxiety, depression, and the domestic violence rates increased a lot. We in Mexico have a really big rate of domestic violence, and with this situation, it increased and 118.9% compared to the same period in the last year. Also, we have really two interesting indicators here. First of all, 7 out of 10 victims of COVID-19 were people who just had primary education or less and that live under the poverty line. And 1 of every 2 deaths were older adults. This, of course, because of health reasons, but this was really important because there was a need for older people to understand how to take care of themselves. When we were talking to the people where we visited before in other humanitarian interventions, we realized that many people didn't understand what was the problem with COVID. They didn't know what was COVID-19. So we realized there was a big need to spread information in an accessible way, because the information that the government was spreading on national television was not enough and was not accessible for everyone. And we realized also that the most vulnerable people during this situation were people with disabilities, indigenous communities, children, elderly, and women. So we wanted to create something that had massive reach with no cost for the people. And we realized that 93% of the people in our country have access to WhatsApp. And what were the needs? Of course, medical orientation, because all of the questions, psychological orientation too, spiritual guidance, and an increase of humanitarian interventions. So we developed a strategy that is called CALL. I will explain it to you later, but what is it offering? First of all, medical orientation. It is a quick COVID-19 test that is made according to WHO criteria. We also give recommendations and basic measures to prevent, a lot of accessible information from COVID-19, all the emergency numbers, and regarding the psychological aspects, we had a network of volunteers who were giving free crisis intervention by phone calls. So this was helping anxiety, depression, the domestic violence programs, and it was not only targeted for the victims, it was also targeted for the aggressors. Spiritual guidance, the religious aspect of the people is really important for them. They were used to celebrate the religious practices inside a building. So giving them the facility to receive this spiritual guidance through distance and with no cost helped them a lot with the psychological aspects and as a dignity of the human being too. And of course, it was a tool that helped us to know all the new needs that we're creating on the ground regarding especially food security. But this tool needed to be made with gender perspective, needed to be accessible for people with disabilities, needed to have information in indigenous languages, and it needed to be accessible for all people too. So we reached national institutions that were working with these particular vulnerable groups, and we received a lot of training to them. We merge all of this information and we create this strategy. What is it? It is a WhatsApp bot and a call center. So all the population could reach our organization and get these services through these two tools. And we have a really big network of volunteers in our organization that wanted to help but didn't know how to do it. So we created also a new network of professional volunteers who were psychologists and doctors and all the operators of the call center who were providing these services with all the training that they previously have and all the training that they were receiving. It doesn't matter if you were a psychologist or a doctor or an operator of the call center, you were trained with indigenous information, with domestic violence perspective, it was also made accessible for people with disabilities.
Abril, you have 30 seconds, I'm afraid.
Yeah, so this is the menu. How did we spread the word? We pasted a sticker on the food pantry we were distributing in every community, and we coordinate with local authorities so that they get to know us. And the results were really, really successful. What do we want to do next? We realize it's an excellent tool for humanitarian intervention, especially for migrant communities, to give a psychological intervention to humanitarian workers that need it to. And we want, of course, to increase the number of users, but because we don't have any more funding, there is no more interest in of the companies to fund projects about COVID-19. So thank you for the Start Network team for letting us be here speaking about our project.
Thank you so much, Abril, and sorry to limit your time. I know there's so much more you could share, and it's a super interesting project, and we're really happy, excited to be working with you. So yeah, thank you. If you could stop sharing your screen, I'm going to invite Christopher Estalo and Kevin Lee to come to the stage next. Christopher and Kevin, I'm not sure who's speaking first, but I'll let you guys figure it out.
Yeah, good afternoon, everyone. Thank you, Neil, Start Network. Happy 10th anniversary, and to our esteemed judges for the opportunity to speak today. I'm joining with me is the executive director of A Single Drop of Safe Water. He's Kevin Lee. The project is a partnership collaboration. Islamic Relief is a faith-based organization based in UK, and we are a member of the START network. In the Philippines, with Kevin, we work in the network called Barangay Resiliency and Innovation Network. So this is bringing in the localization agenda Islamic Relief really embrace and put more emphasis on localizations in the Philippines, especially in conflict-affected areas. So as well, good congratulations to everyone who, Tier Fund, Cadena, and all joining us this afternoon. So a bit of this project, and then Kevin Lee, my colleague Kevin Lee will be able to elaborate further. So this is a long-term crisis where standard NGO response model are sustainable. We wanted to model a governance-based approach at the lowest level. We call it barangay, where local governments and communities are able to prioritize issues and develop their own solutions, or network with assistance suppliers from a position of power so as to effectively direct the right aid to right places. So I'll stop from here, then over to you, Kevin.
Thanks, Chris, and thank you to the START Network for this opportunity. So brief background on how we developed this is we developed a theory of change within a social entrepreneurship ecosystem of Ashoka. So I am an Ashoka fellow through Single Drop. And through this network, we came up with a theory of change, trying to leverage government systems to improve the way that they approach the response to COVID-19, as well as response overall, knowing that the largest resource we have in country is the government for funding and the communities themselves as far as human resources. So we developed this theory of change quite early on, March, April. We were Single Drop, we were working with Archinova funding, doing some disaster risk reduction in the WASH context work in the Puerto Princesa and Palawan. And what we did is we kind of bullied them into supporting this new system of working. And so we changed the way that we did the planning process to be more human-centered. And basically, the biggest change we did in the planning process was actually asking people what they knew about COVID and leveling off, and asking them about their experiences. And from that, then we started developing what was our vision for the future and the ideal situation, and then started running scenarios of different infection points, etc. And from that, we were able to come up and analyze gaps. So what we want to do is we have to have systems thinking so that we can actually leverage government systems. So we use the human-centered approach for the design and for the planning process, but then made sure that it fit in with government planning procedures and planning frameworks. So the thing that makes this important to us is that outside NGOs and outside experts, we get rid of any pretense of outside assistance. And what we're doing is we're just facilitating the communities and local governments to go beyond just participating in their response, but actually leveraging their own resources and capacities to do it themselves. So this is why we call it Barangay Resilience and Innovation through Empowerment. So once we do the planning is all and good, but now we're trying to work on how do we take those gaps, those high priority gaps, and turn them into solutions. So we're now in the process of developing a design thinking workshop so that we can work with the communities and the local governments to actually brainstorm and figure out how to solve these problems and prototype them and test them throughout
Kevin,
the process.
I apologize, yep. You have 30 seconds, mate.
Yep. So ultimately, what we're doing is we're doing the human-centered design to identify the gaps, and then we're looking at going through the design thinking to come in with solutions. And we're doing this under 3 pillars, which is governance and data management, behavior change and communication, and then basic service delivery and assistance. And so we're hoping that through this process that we actually empower communities, not just to react to COVID-19, but to be actually more resilient in the future. Thank you.
Awesome. Thank you so much, Christopher and Kevin. And we're really looking forward to seeing how that program develops as well. And then finally, I'd like to hand over to Mikhail Tesfasilasi from Tear Fund in Ethiopia. Mikhail, please tell us a bit about your project. So I think we might have lost Mikhail. He might have dropped off the line. Zofia, can you see him? Zofia, if you can see, I think yes, Mikhail's.
One second.
If he's not there, if you can see David in the audience. Oh, Mikhail is back.
Yeah.
Hi, Mikhail. Go ahead.
Can you hear me now? Sorry.
Yeah, perfect. Yep. All good.
Yes. Right. Yeah, okay. I was trying to open the video. Thank you very much, first of all, for giving us this chance and trying to work on this innovative idea. Thank you, Start Network. Michael, the Global Agriculture and Market Advisor. I'm based in Addis. Our new idea is on community inclusion currency. Tear Fund Ethiopia has been working a lot on self-help groups. These are a group organized in like 20-25 people. They work hard to solve their poverty issues and to elevate all those low-income issues. So we have been working with them to empower with some local organizations, but when the COVID comes, they lost the businesses. They lost everything. The businesses, the employment was going down. So we tried to help them by introducing a digital currency to these groups. So it's important for us because it's it's an innovative idea. And it's a way to solve their problems by their own means. So we are working on their resilience and we give them some room to invest the cash on highly needed items. Because most of the self-help groups, they have small restaurants, small shops. They are selling some breads or injera, local bread, to the restaurant. And the restaurant business was also reducing. but there could be a linkage within the group or with other groups, but they need cash. So that cash is limited because of the economic downturn. This is an innovative idea that helps them to free some money. Then there will be a digital currency revolving around. It needs a lot of co-designing. We don't want to suggest or prescribe a kind of solution to the community, but we will be working with the community to tailor depending on their context, depending on their needs. So there will be a lot of assessment, co-designing, and piloting and testing of this idea. So TFN has been working a lot with local organization. We have that platform, which is a great start. The group itself, they know each other, they have been together, but we want to introduce a new kind of currency, which can include the low income or the desperate people who are less employed at this time or generating less income. By doing this, we facilitate the economic growth within the country, within the small village. That money will continue to revolve even without spending the paper money that's printed in the country. So this is the whole idea. Thank you very much.
Brilliant, thank you, Mikhail. Yeah, so we are, we're really excited to have these 3 projects. We're excited that they're going to be going on a journey over the coming months to develop these ideas further and hopefully to iterate on their ideas with the support of Thoughtworks and make them stronger. So we'll be sharing their journey on the Start Network websites as we go, if you would like to follow them. And let me actually put up my email address as well, because for those of you who would like to know more, let's see if we can get that to actually work. There we go. For those of you who would like to know more, please do get in contact with me. I can hook you up with any of these 3 teams if you would like to ask some questions directly or think about replicating some of what they're doing in places where you're working. With that, I'm sure would be an option as well. So yeah, thank you so much, everyone. I think we're more or less out of time, but just to say big thanks to everyone for participating. Thanks again to all the applicants, to the judges, and to Thoughtworks. Enjoy the rest of the assembly.
Thanks, everyone. And congratulations to all the
Yes, thank you, everyone. Thank you, Neil and Sophia.
Thanks. Bye.
Thanks, guys. Thank you.
Thank you, everyone, and congratulations.
Thank you,
Yeah, you too. And happy 10th anniversary to Start Network.